Hi, I'm Joe Graydon.
I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy, where we bring you the stories behind the health headlines.
This podcast is brought to you by Redix Industries, makers of Utterly Smooth Body Cream. 800-345-7339, on the web at uttercream.com. Parkinson's disease is a progressive, debilitating movement disorder. Can something as simple as exercise control symptoms? This is the People's Pharmacy with Terry and Joe Graydon.
Medications can be helpful, especially in the early stages of Parkinson's, but the benefits eventually fade. Intense exercise has been shown to control symptoms at least as well as medicine without the side effects. The researcher behind this discovery tells us how it works.
High-intensity interval training can also be beneficial for the rest of us. You're never too old or out of shape to benefit from some kind of exercise.
Coming up on the People's Pharmacy, the research for pedaling for Parkinson's and how we can all benefit from physical activity.
First, this news.
In the People's Pharmacy health headlines, how effective are flu shots? The influenza virus changes from year to year, and consequently, the vaccine must change as well to keep up. This means that experts need to study vaccination effectiveness every year to be able to tell how well their vaccination programs are working. An analysis of the results from the 2015-2016 flu season has just been published in the New England Journal of Medicine. The researchers used data from the Influenza Vaccine Effectiveness Network, which kept records on children older than 6 months who showed up with respiratory infections that season. The news was not good. The live attenuated quadrivalent vaccine that was expected to provide powerful protection against influenza was ineffective. Overall vaccine effectiveness was 48%. That included inactivated influenza vaccine, which performed significantly better. This is not the first time the live attenuated flu vaccine proved disappointing. During the winter of 2013-2014, the live attenuated vaccine was also ineffective in children. The Advisory Committee on Immunization Practices did not recommend the use of live attenuated vaccines last year.
Gallbladder removal is one of the most common surgical procedures in the United States. It's performed when gallstones made of cholesterol or bilirubin block the bile duct, causing intense pain. In any given year, roughly 700,000 people undergo this kind of surgery called cholecystectomy. A new study from France shows that a Mediterranean diet reduces the risk of gallbladder surgery by 11%. The more fruit, vegetables, beans, whole grains, and olive oil women ate, the less likely they were to need a cholecystectomy.
Many people rely on caffeine to get going in the morning or improve alertness during the day. Researchers have now found that caffeine might speed recovery from general anesthesia. Sometimes surgical patients are slow to become fully awake following an operation. Research in rats shows that injecting caffeine towards the end of the procedure can shorten recovery time by about 55%. The scientists determined that caffeine is working in 2 different ways to increase cyclic AMP in the body. This is the way in which it overcomes anesthesia-related sedation.
Researchers are reporting that death rates from colorectal cancer have been increasing in American adults under 55 since the mid-1990s. The increased mortality is limited to white Americans. African Americans have actually experienced a decline in mortality from this cancer. The authors of the research encourage earlier detection and prompt follow-up of any symptoms, such as a change in bowel habits, rectal bleeding, abdominal cramping, fatigue, or unexplained weight loss.
Blood pressure does not remain constant. It changes throughout the day depending upon stress, physical activity, and many other factors. A new study from Japan has reported that people whose blood pressure varies the most from day to day may be at greater risk for dementia as they age. The researchers used a month's worth of home blood pressure measurements among more than 1,600 older adults. People with roller coaster blood pressure were twice as likely to be diagnosed with dementia over the next 5 years. Whether controlling fluctuations in blood pressure would protect the brain has not yet been determined.
Having a sedentary job that requires you to sit and stare at a computer screen all day is bad for your health. Brazilian researchers found that naval employees who had desk jobs were able to counteract the negative effect of their sedentary work by exercising vigorously during their leisure time. If they engaged in at least 30 minutes of moderate to intense exercise daily, they could ward off abdominal adiposity, that's a big belly, high blood pressure, and low HDL cholesterol. These are all markers for metabolic syndrome, which in turn increases the risk for hypertension, type 2 diabetes, and heart disease. And that's the health news from the People's Pharmacy this week. Welcome to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. There are nearly 1 million people in the United States with Parkinson's disease. It's a condition that interferes with normal coordination and movement. They may develop tremors, find that their movements have slowed or become stiff, and have trouble with their balance. Medications can help with these symptoms, although their effects wear off with time. What if exercise could help? Pedaling a bicycle harder and faster than you thought you could just might offer relief from many of the symptoms of Parkinson's disease.
To find out about this fascinating idea, we're talking with Dr. Jay Alberts. He's Vice Chair of Innovations within the Neurological Institute of the Cleveland Clinic and a researcher in the Department of Biomedical Engineering. Dr. Alberts has been leading the Pedaling for Parkinson's program for 15 years and is translating observations from the field to the laboratory and onto the community of Parkinson's disease patients.
Welcome to the People's Pharmacy, Dr. Jay Alberts.
Thank you very much for having me today.
It's a pleasure to have you. Dr. Alberts, you know, this condition that you have to deal with, Parkinson's disease, is nasty. It's chronic, it's progressive, it's incurable, and it leads to a lot of disability. And I guess I'd like to find out how you first got interested in this notion of exercise in general and forced activity in particular, and what you found.
Sure. Well, I want to echo what you said earlier about the disease. And what I think really captures it for me is that the disease is trying to steal control. It's taking control from the patient. And, you know, one of the things that we did in terms of getting into exercise specifically was we wanted to give patients an opportunity to take control or take back control some of what the disease had taken from them. So in 2003, this really started with that effort to go across the state of Iowa on a tandem bicycle with a Parkinson's patient and to let the people in small-town Iowa know that if you might have a diagnosis of Parkinson's disease, you don't need to let that disease take over and take control of you. And so it was really just a message about go, be active, do things, et cetera, et cetera. And then during that ride is really when we had this, you know, sort of unexpected finding or information that, you know, riding the tandem bike actually helped Kathy's symptoms. And that was sort of this aha moment, and then we built on that over time.
Do tell us a bit more about that, please.
Yeah, so it was interesting. So, you know, if I go back a little bit, so the person I rode with on the tandem was Kathy Frazier from Atlanta, Georgia. I was at Georgia Tech at the time, and the original plan was she was supposed to ride the tandem with her husband, Ralph. And Ralph and Kathy rode probably the first half day together. And if you or any of your listeners have ridden a tandem bike, you know that it certainly can challenge even the best of those relationships, you know, from a marital perspective. So, right. So just as an aside, when I have graduate students who are thinking about getting married, I tell them they should go rent a tandem bike with their potential spouse, and that will just accelerate you to the final destination of your relationship. And so you can imagine on a tandem across the city of Iowa, Ralph and Kathy, had some less than optimal interactions because they were married. So on that first day, I told Ralph, hey, why don't I finish out the day with Kathy, and you can ride your single bike and I'll ride with her. So it turns out Kathy and I had a great time riding the tandem together, probably because we were not married. And during that time, we eventually then just rode the rest of the week together. And two things happened during that week. She told me, hey, when I'm on the bike, it doesn't feel like I have Parkinson's disease. And I said, well, that's, we're in Iowa. It's God's country. We're eating homemade ice cream and pie, and, there's no traffic like Atlanta. It's probably just a stress thing. And then the other thing that happened was she wrote a birthday card out to one of the members in our group. It said, "Happy birthday, Gary." And I saw that at our campsite, and I said, "Who wrote this?" Because I knew none of the other people in the group were going to give Gary a birthday card. And it was beautiful handwriting, and that's why it was so shocking to me or puzzling, like who wrote it. So because Kathy typically had micrographia or smallness and illegible handwriting, but the card that she wrote was absolutely beautiful. It was beautiful handwriting, very legible, and normal size. So that was really when I started thinking about, well, maybe there's something going on in terms of riding the tandem bike, because what happens when you ride a tandem bike is the front and rear person have to pedal at the same rate, because the two sets of pedals are linked via a chain. And so in talking with Kathy and then subsequently other people I rode with, it turned out that they typically on their own would pedal about 40 to 50 RPMs. Whereas when I was on the front of the tandem, I would pedal at 80 to 90 RPMs. So in essence, I was forcing them to pedal at a faster rate than they could on their own. So then when you put this in, I was thinking about this and looking at the exercise literature. I went to the animal literature that others have published on, and they had identified this concept of forced exercise, and that actually improved symptoms. Now, the way they were inducing forced exercise on mice and rats was to put them on a treadmill and have an electric grid behind the treadmill. So if they didn't keep pace with the treadmill, then they would get shocked, hence the term forced exercise. And so that's where I sort of drew this parallel. I was forcing Kathy and others to pedal at a relatively high rate, a rate faster than they could on their own, of course, without any shocking. But it was that same kind of concept, and that is really where it all started, in these observations in Iowa.
Now, Dr. Alberts, you have described one of the symptoms, which was this handwriting, illegible handwriting, that then dramatically improved after that exercise. I wonder if you could share some of the other symptoms and give us a brief overview of Parkinson's disease.
Sure.
What we know about what causes it, what the symptoms are, and how people often end up. And then maybe what you think is happening with the exercise and the experiments you did.
Sure, absolutely. So Parkinson's disease, we don't know exactly what causes it. We know that about less than 1% of individuals who have a gene, a LRRK2 gene, will eventually have Parkinson's, but that's a very tiny, tiny percentage. Again, there have been different environmental agents that have been suggested to cause it. Right now, I don't think we know exactly what causes it, but we know that it's this degeneration of cells within the basal ganglia. And it's that, basically, the disruption in the level of dopamine and the neurotransmitters that result in the sort of 4 or 5 sort of cardinal symptoms associated with Parkinson's. So the first, obviously, and most visible is tremor. Your hand, and you probably have seen it, the hand is shaking, or a leg, or et cetera. Another one is bradykinesia, which is slowness of movement. And then you also have akinesia, which is difficulty initiating movement. And you have postural instability and gait declines. So they have an increased risk and rate of falling. And then another classic clinical symptom is this cog-wheeling effect, sort of a ratcheting effect. in the legs or even the arms. So those are sort of the classic symptoms associated with Parkinson's. Typically, again, it's, as you mentioned at the top of the show, it's a chronic progressive disease. So those symptoms typically get worse over time. There's no exact science in terms of the rate of progression. And, typically individuals do not pass away from Parkinson's. It's complications related to one of the symptoms.
Now, Dr. Alberts, you've told us about the aha moment when you and Kathy rode across Iowa on a tandem bike. Can you tell us where you took that? What was the next experiment?
Yeah, absolutely. So, at the time I was a young assistant professor at Georgia Tech, and I was really focused on deep brain stimulation. And so I had, done some other things associated with exercise. But really what I did was, I did more rides with Parkinson's patients in a tandem, went down to Tucson, did a ride, and did Iowa ride again. And I kept getting this feedback that, it feels good. But it wasn't until 2007 when I had a Parkinson's patient who had deep brain stimulation, which, again, I was very familiar with, who rode with me, and he said, well, let's test your idea of how well this exercise stuff works. Let me turn off my stimulator. So he turned off his deep brain stimulator, and his tremors and everything came back very rapidly. And then we hopped on the tandem, and we rode, and his stimulator was still off, yet his tremors were gone, and his symptoms were improved. And it was really that sort of second aha moment that I thought, we need to investigate this systematically. So went back to the laboratory. Now, at this point, I'd moved to Cleveland, to the Cleveland Clinic. Went back to the laboratory and developed a protocol in which we did a pilot study with 10 patients, brought them through an actual tandem bike exercise protocol for 8 weeks, and showed that they had about a 35% improvement in their motor function from when they started exercising to when they stopped exercising after 8 weeks. And so that was really the first, attempt to sort of systematically evaluate this in a laboratory setting and think about, is there really something going on? And those findings were very positive. They were, I would say embraced fairly well in the scientific community. We subsequently got a NIH grant to develop a exercise cycle that would replicate to some degree what was happening on the tandem bike. We fully appreciated that using a tandem bike is not sustainable or scalable to a larger amount of patients. And so we successfully completed that. And then we recently, 4 or 5 years ago, were awarded a NIH R01 clinical trial award. And we just recently completed a 100-person NIH clinical trial to look at the effects of forced exercise and voluntary exercise on Parkinson's symptoms.
You're listening to Dr. Jay Alberts, Vice Chair for Innovation in the Cleveland Clinic's Neurological Institute. He's also a researcher in the Department of Biomedical Engineering. He's been leading the Pedaling for Parkinson's program for 15 years.
After the break, we'll discuss the differences between forced and voluntary exercise.
Does exercise work better in the early stages of Parkinson's disease?
Might exercise have benefits in other neurological conditions, such as Alzheimer's disease?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
If you value the health information you get when you listen to The People's Pharmacy, consider subscribing to our email newsletter. You'll get the latest health news and information on upcoming podcasts delivered to your inbox twice a week. Look for the link at peoplespharmacy.com. Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of utterly smooth creams and lotions that deeply moisturize to make dry skin feel soft and smooth. 800-345-7339. The website is uttercream.com.
If you would like to purchase a CD of the show, you can call 800-732-2334. Today's show is 1090. That number again, 800-732-2334, or visit our website, peoplespharmacy.com. You can also download the podcast from iTunes.
Today, we're exploring the benefits of exercise, especially forced exercise, for the symptoms of Parkinson's disease.
We're talking with Dr. Jay Alberts. He's Vice Chair of Innovations within the Neurological Institute of the Cleveland Clinic, and he's a researcher in the Department of Biomedical Engineering. Dr. Alberts has been leading the Pedaling for Parkinson's program for 15 years and is translating observations from the field to the laboratory and on to the community of Parkinson's disease patients.
Dr. Alberts, you've made it clear that you were pedaling faster than the Parkinson's disease patients would have pedaled on their own, and that there is a value to the forced aspect of this forced exercise. Can you tell us why that's different from voluntary exercise?
Yeah, so I think what we're doing there is, and it's really important to mention or note that just when you're doing forced exercise, that doesn't mean you're sitting on the back of a tandem or in a bike with a motor and letting your legs get jiggled about rapidly, right? So what we did is we put a power meter on the back and for my pedals and for the Parkinson's patients' pedals. And what we identified was that even though I was pedaling faster, they were not just passive. They were still actively contributing to the activity. So I think it's a combination of, you're increasing the rate of pedaling and you're also increasing the quality of pedaling, and they are actively engaged in that. You're really providing them, we use the term forced exercise only because of the animal literature, but really we're providing them a helping hand, if you will. And I think what's happening there is we're probably triggering some release of neurotrophic factors within the brain that then, is producing these potential changes in actual brain function.
So you conducted this really impressive study, and I guess our listeners are wondering, well, you rolled it out to 100 people. What did you find?
Absolutely. So what we found was very positive results. We found that there was a significant improvement in those individuals who completed forced exercise and voluntary exercise for 8 weeks compared to the control subjects. And the magnitude of those differences were statistically and clinically meaningful, and they exceeded the minimal clinically important difference. And so I think the main take-home point is that, even after 8 weeks of exercise, we can improve the motor and some of the non-motor symptoms associated with Parkinson's.
Well, that's pretty extraordinary. And I guess one of the first questions I have is the medications that are used often work pretty well for the first couple of months, and for some patients, maybe even for the first couple of years. And then they tend to wear off. What do you expect in terms of exercise? I mean, is this something that's sustainable?
Yeah, no. So I think it's absolutely sustainable, and I think you're right in terms of that. I think about it as a window, right? So the medication window is very wide open. It's very effective for most patients early on. As the disease progresses, that window closes in terms of medication efficacy. Our goal with exercise is not to replace medication. Rather, medication and exercise can work together, and exercise can help keep that window open longer. And that's really where I think how we need to look at these things. It's that it is an adjunct treatment to medication.
Is exercise more effective for people in the early stages?
That's a great question. That's something that we are looking at right now, and we hope to have some additional funding to evaluate, is to really think about, can we change the slope or the progression of the disease? And if so, is that more effective early in the disease compared to late? Intuitively, you would think early in the disease would be better, but we do have data that indicate that even individuals who have been diagnosed for the past 20 years, they also showed some improvements in motor function. So I don't think it's restricted to one group or another.
Dr. Alberts, one of the One of the problems with exercise is that it requires some motivation for people. So, oh, it's too cold out. Oh, it's too hot out. Oh, I'm too tired. Oh, I'm too stressed. We all have, our excuses for not participating in vigorous exercise. And I'm curious how these Parkinson's patients have responded. I would think that relief of symptoms might be a pretty strong motivator. Was that the case?
No, absolutely. We had a tremendous attendance rate. I think our attendance rate overall was like 99.6%. And you have to remember, we're in Northeast Ohio. We have snow. People were coming, everything else was shut down, and they were showing up like, okay, well, yes, I exercise at 9 o'clock in the morning, so I left my house at 7 and I made it here. So that was something that we noticed, for sure, that the motivation is there to continue exercising. And the other thing I would say to that is, if you think about medication or deep brain stimulation, no one would ever propose that you take this medication for 8 weeks and then you stop, right? And I understand the difference in terms of, it's easier to take a pill. But I think that the attraction here is that, exercise is now giving the patient a level of control that they didn't potentially have before, right? Because your medication was, your dose and such, that was identified by your movement disorder neurologist or your physician. And this doesn't take anything away from physicians, but that was not decided by the patient. This is something that now, gives the patient a level of active participation and control, which I think, that's probably why we see some improvements in some of the non-motor functions and mood measurements as well.
How long do the symptom relief last?
Yeah, great question. So again, I don't think 8 weeks of exercise is the panacea. It's not a cure to Parkinson's. However, what we did find is that even 8 weeks after they stopped exercising, there were still significant improvements in motor function. So to me, what that suggests is 8 weeks of exercise is somehow changing brain function or modifying brain function some way, and those changes have the potential to be relatively long-term. But again, I'm not suggesting you exercise 8 weeks, take 8 weeks off or whatever. I think the value here is to show that we are able to change brain function, and if you continue to do it, it would appear that we're going to have sustained improvements.
Dr. Alberts, you are Vice Chair of Innovations within the Neurological Institute at the Cleveland Clinic. So you're concerned, I'm sure, with things beyond Parkinson's disease. Can you imagine the day that you might want to do research in other neurological conditions and maybe even look into the possibility that this kind of forced exercise might be beneficial against something as serious as Alzheimer's disease?
No, absolutely, 100%. And so we're already doing some of those studies in other neuropopulations. We have a stroke study going on right now, right? So people after having a stroke, you often hear the concept they have to relearn how to do something. Well, we think that if you can increase these neurotrophic factors, and we have good data to suggest from a clinical perspective we are improving outcomes, but if we can improve the neurotrophic factors or increase them, we may be able to facilitate this motor relearning. And so we have good data now in patients with stroke. We're also looking at this in individuals who are obese, because obese individuals start lots of exercise programs, but they quit lots of exercise programs. And it's been identified that they quit for a couple of reasons. One, it's hard, as you mentioned before. I'm tired, I'm not motivated, etc. And the other is they don't have an internal reward associated with the exercise. So if we can provide this helping hand, we can potentially make the exercise not quite so hard. And if we're able to adjust these or improve or increase these neurotrophic factors, maybe we can drive their internal reward system. So that's something that we have a clinical trial ongoing now, looking at individuals who are obese. And we have colleagues who are certainly looking at and exploring this in individuals with mild cognitive impairment as well.
Dr. J. Alberts, Thank you so much for talking with us on the People's Pharmacy today.
Thank you very much for having me.
You've been listening to Dr. Jay Alberts. He's Vice Chair for Innovation in the Cleveland Clinic's Neurological Institute. He's also a researcher in the Department of Biomedical Engineering. He's been leading the Pedaling for Parkinson's program for 15 years, and you'll find links to some of his published research reports from our website, peoplespharmacy.com.
How well does Dr. Albert's research work in the real world? To find out, we turn now to Kathy Helmuth. She's the co-creator of the Parkinson's Cycling Coach Training Program. She's a registered nurse and a wellness professional at the Sarasota, Florida YMCA.
Welcome to the People's Pharmacy, Kathy Helmuth.
Thank you so much for having me. I am excited to talk about this program.
Well, we're excited to talk to you as well. We just had an opportunity to talk to Dr. Jay Alberts about his research, and you're actually implementing the program. Can you tell us what you're doing?
Oh, absolutely. And once again, thank you. I'm just so happy to always hear someone talking to Dr. Alberts because he's a phenomenal researcher and physician. So that's terrific. What we're doing, the description of our program, that what we're doing is we're taking Dr. Jay Alberts' research and we're implementing it. And my partner and I have created an online training for Parkinson cycling coaches. And Parkinson cycling is a Group X indoor cycling program for people who have Parkinson's disease. It's designed just for them. So that's how we go about providing the training online. And then we're all part of a group exercise program, which is absolutely terrific.
Kathy, I wonder if you can tell us about one or more of your Parkinson's disease patients who went through the program. What kind of changes did you see?
Oh my gosh. We've seen so many. We've had so many success stories. When we first started coaching this program, we've been doing this since 2010. I've been doing it since 2010. And when we started seeing all the successes from the program, we were inundated with people calling and saying, can we get this program at our facility? And, because we were seeing all these positive changes. So that's why my partner and I put together the training. We have an online training for the program. So that's why I'm hoping I'm talking to you as far as that goes too. But the changes that we've seen are wide range. The first thing that we typically see, and I'm not saying 100% of the time, but most often we see a better gait, meaning that people can walk better and they're more stable. Because a lot of times when people come into this class who have been diagnosed with Parkinson's disease, they have balance challenges. So consequently, a stationary bike in a room that is filled with other people who have the same disease, they actually are safe there because we're monitoring their heart rate, we're monitoring their balance on the bike, and they're very, very safe. So that's the first thing that we see, a gait and stability improvement. Sometimes we'll see an actual improvement in tremor. Sometimes we won't, but many times we will. So tremor is a big part of Parkinson's disease, one of the first symptoms usually that surfaces. So we see an improvement in that. But I have to share with you just a couple of other things that we've seen. It's so valuable. Something fun. We have a gentleman who has come into class and he lost his smell. And a lot of times that does happen with Parkinson's disease. You will lose your smell or sense of smell. Not everyone, some people. One day I walked into class and he was on his bike and he was actually crying. And I said, Richard, what's wrong? I didn't know what was wrong. It kind of scared me. He said, I smelled my wife's chocolate chip cookies last night. And it was something that was so important to him, so trivial maybe to you and me, but that was very, very valuable to him. So his symptoms improved as far as his sense of smell. But many other people have had things such as not having to add any more medication. We have one individual that I'm thinking of. Her name is Lynn. She started the program with us in 2013. And in the last 4 years, she has not had to add any more medication. That means even dosage-wise. So something positive is really going on here.
How can people learn more about the program?
Our training is online, and they can go to parkinsoncyclingcoach.com. So we offer that online training for potential and qualified coaches. But they can also check in with our local YMCA, because I know that the YMCA is indicating that they're wanting their programs to be at their facilities. So it is growing. They can even Google it, and they'll find out that they can Google a cycling for Parkinson's disease. They'll learn more about that with Dr. Alberts. If they do Google that, they can find more about that. They'll find us. They'll find YouTube videos that we offer showing classes and things like that. So there are ways to find out about it.
Kathy Helmuth, thank you so much for talking with us on the People's Pharmacy today.
I am delighted. Thank you for asking me to be part of this program, and thank you for your interest in the program as well. It's a very, very fine program.
You've been listening to Kathy Helmuth. She's co-creator of the Parkinson Cycling Coach Training Program. She's also a registered nurse and a wellness professional at the Sarasota, Florida YMCA.
Earlier, we talked with Dr. Jay Alberts. He's Vice Chair of Innovations within the Neurological Institute of the Cleveland Clinic. He's also a researcher in the Department of Biomedical Engineering there. Dr. Alberts has been leading the Pedaling for Parkinson's program for 15 years and is translating observations from the field to the laboratory and on to the community of Parkinson's disease patients.
Well, I think it's fascinating that not only does this exercise program potentially help movement, and we think of Parkinson's as a movement disorder, but it has other symptoms as well. And Kathy's story about the man whose sense of smell was restored was just fascinating.
The other thing that's so critical is this idea of keeping the window open longer, because ultimately with Parkinson's disease, the medications begin to wear off and you need higher doses and other medicines. And I'm also intrigued by the possibility that this kind of a program, this intense exercise, might work for other neurological conditions like cognitive decline. Clearly, there's something going on inside the brain. We need to take a short break, but when we come back, we'll consider the possibility of doctors writing prescriptions for exercise to benefit our brains as well as our bodies.
Why is exercise good for the brain?
How can people get motivated to engage in exercise even without a prescription?
What is high-intensity interval training, and how does it work?
Find out how everybody can benefit from exercise.
You're listening to The People's Pharmacy with Joe and Terry Graydon. Thanks for listening to this podcast of The People's Pharmacy. If you like it, why not rate or review it in the iTunes store? We'd appreciate it.
Welcome back to The People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. The People's Pharmacy is brought to you in part by Red X Industries, makers of Utterly Smooth Foot Cream with Shea Butter, helping dry, cracked feet feel utterly soft and smooth. 800-345-7339, online at uttercream.com.
To purchase a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1090. That number again, 800-732-2334, online at peoplespharmacy.com. You can also download the free podcast from iTunes or from our web store. We invite you to consider writing a review.
Today, we're talking about exercise. We've heard how forced exercise can help quell the symptoms of Parkinson's disease, and we've learned about programs at the YMCA that can provide this type of healthy intervention. But isn't exercise good for everyone?
To find out, we turn now to Dr. Jordan Metzl. He's a nationally recognized sports medicine physician, best-selling author, and fitness instructor who practices at the Hospital for Special Surgery in New York City. Dr. Metzl created the Iron Strength Community Fitness Program that provides free fitness classes for thousands of New Yorkers each year to promote activity and wellness. His most recent book is Dr. Jordan Metzl's Workout Prescription, 10, 20, and 30-minute high-intensity interval training workouts for every fitness level.
Welcome back to the People's Pharmacy, Dr. Jordan Metzl.
I'm so happy to talk to you guys. It's an absolute pleasure.
Dr. Metzl, you are arguably one of the world's foremost exercise enthusiasts, and as a physician, you write a prescription for exercise, which I wish more of your colleagues would do on a regular basis, but in particular the neurologists, because we've just talked about Parkinson's disease. We've heard that exercise may be one of the best ways to prevent Alzheimer's disease or dementia, good for the brain in general. Give us your perspective on why exercise is so important for the nervous system.
You betcha. So I think kind of brain and body. My general take on this is that if you had a drug that worked for every single person who took it, it had 100% efficacy, it had zero side effects, it was free, and it was ubiquitous. Anybody could take that drug anytime they wanted, and every physician around the world, if they didn't prescribe this drug to every single person that walked into their office, they would be committing medical malpractice. And in my mind, that's what we have with exercise. Now, we can talk about the role of exercise in particular diseases, intensity, high intensity versus low intensity versus moderate intensity, but I think the big picture topic here is that this drug of exercise and the medicine of exercise is so incredibly potent that rather than spend all of our efforts and energies trying to treat disease after it's already happened, which we do in America to the tune of $3 trillion a year, we should be not only talking about but actively incentivizing and teaching people how to prescribe the medicine of exercise to their patients, and that includes doctors such as neurologists who unfortunately are spending much more time in their offices treating the after effects of people that get dementia, including Alzheimer's, et cetera, when we know that high-intensity interval training and good exercise can work not only on the preventive side, but also it's the only drug that seems to slow the development of many of these neurologic conditions. And also we talk about psychiatrists, depression, anxiety, sleep, et cetera. So this drug works across the entire spectrum of the brain and the entire spectrum of the body. And so some of the things we're trying to do at Cornell is to try and start now in our third year the first symposium on prescribing the medicine of exercise to the second-year med students, and we've had to really work on that. And then, in addition, I've been working on starting my own fitness classes, which started very small about 4.5 years ago. I taught a class this morning in the rain in Central Park. We have a 1,000-person workout class next week on the flight deck of the Intrepid. It's really exciting to kind of watch this grow and develop. So I think there's a lot to do and a lot to think about changing the paradigm of kind of being reactive to treating disease rather than proactive and thinking about preventing disease before it happens.
Now, Dr. Metzl, this isn't just your opinion or just your exuberant enthusiasm. There's real data. We've got research, right?
Not only do we have research, we have compelling research. And yes, I feel like I'm by nature a motivator, but to me this answer is staring us in the face so plainly. And I think it's a fundamental problem with the way medicine has evolved over centuries. We are very much involved in disease treatment. We treat disease. We treat arthritis. We treat osteoporosis. We treat cancer. There was a 1.4 million person study published in JAMA last year looking at exercise and the reduction of 13 types of cancer, which was a very strong correlate: breast cancer, recurrent breast cancer, ovarian cancer, colon cancer. So we unfortunately spend so much effort and energy and cost treating type 2 diabetes, which is our most expensive disease, more than $100 billion a year, cardiovascular disease, about $85 billion a year, back pain, $70 billion a year. We need to really think about, making preventive health and, most importantly, preventive exercise. I don't care if somebody's mild to moderately overweight. I care if they're inactive. And we have great data across multiple disease states and multiple body systems about the role of exercise for the prevention and treatment of disease. And so the question is, why the heck aren't we prescribing this, and why aren't we incentivizing people to take it?
Well, that is actually the next question I want to ask you. Why aren't your colleagues prescribing exercise, and more to the point, and also, why aren't people exercising? Because you don't have to have a prescription in order to go out and move.
You betcha. Well, I guess let's start with the second part of that question first. Why aren't people doing it? So, I've kind of found, and in all the books I've done and in all my fitness classes, those who have drunk the Kool-Aid of exercise are still drinking the Kool-Aid by and large. If you're motivated to do it, you're going to keep doing it. Some people are dabblers, and then some people are completely disinterested. And I think we need to kind of turn the dabblers and get the disinterested interested. And so the question of why people don't do it is they don't see the value. And sometimes, much like somebody doesn't see the value of wearing sunscreen until they get skin cancer, they don't see the value of exercise until they get a heart attack or have a heart attack or get diabetes or some of these problems, which we see as a result oftentimes of inactivity. And so when I start thinking about this, why people aren't doing it, I think we haven't really set up, first of all, they may not like it, but we haven't set up the systems to really make this happen. So our Iron Strength community fitness classes started with like 20 people in the basement of a gym. Our listserv for these classes is now up to 35,000 people. And we've been surveying our participants, what makes you want to come? Why do you come to these classes? And the number one reason, what would you guess is?
I can't guess.
Fun.
Well, that actually makes a lot of sense.
It
does.
It's so simple and so brilliant, and
that is why Joe plays tennis. That is why I go to karate class, because it's fun.
Fun, and so if people are smiling, and there was a really interesting study published in Psychology. It was done in Germany, where they took 24 subjects and then 17 control subjects, and the goal was to get them over a 12-week period of time to exercise more along the guidelines of the American College of Sports Medicine. The 24 subjects were given positive reinforcement. They had a role in their fitness classes. They were given positive reinforcement. They were smiling. They had group instead of individual. The 17 controls were just given regimented, I'd say Germanic, non-smiling personal trainers saying, do this, do this, do this, to do this objective. And then they looked at their data 12 weeks after these implementation of these programs, and there was a very strong statistical difference in the people who had the positive reinforcement in the groups. They were more likely to exercise, on average, about 2 times more per week than the non-fun people, and for about 15 minutes longer than the non-fun people. So thinking about people having fun is a huge piece. If you're not smiling in your karate class or in your tennis game, then do something else. You have to find something that motivates you. And, in today's world, we can do things such as, fitness trackers or virtual fitness classes or group classes or whatever. It's all about getting people to think about what will make them have a good time and smile. And I think we've been doing a lot in terms of looking at that in our classes, which has been very interesting to me.
Well, I'm really intrigued by the idea of trying to get the dabblers to move away from, left-handed Thursday exercise to every Thursday, to Tuesday, Thursday, and Saturday. Is fun the way to do it? And what about somebody who lives in the middle of Wisconsin and it's cold in the winter and nobody wants to go out and do anything?
So that's an interesting question, and I'm glad you asked. So, fun is a great way to keep people going. It's not generally a great way to get people going or get many people going because they don't know it's fun because they haven't started. So people have been looking at studying incentive and what incentivizes people to be active for a while. And first of all, there was a kind of a big meta-analysis published in 2012, 2013 looking at exercise habits in the United States in the Journal of Preventive Health and Preventive Medicine. And their comment was that sedentary individuals respond to incentive 100% of the time. In other words, we are glorified lab rats, and if you give us the sugar water, we'll go there. So the question is, what is the sugar water? What incentivizes people to move in a certain direction or to move in general? And the answer is, we have to figure out what incentivizes them, but my feeling on this, and others who have been studying this, have looked at things such as money. Money is a great incentive. For example, if you work at Cerner Corporation in Kansas City, every day you take 10,000 steps, you get $1. People have studied at the VA hospital more.
Whoa, wait a minute. $1?
$1 a day.
That's all it takes?
No, it doesn't take much.
Yeah, and there are some other workplaces that have maybe not $1 a day, but other incentives if you've got your 10,000 steps a day.
You betcha. And people in a number of companies are experimenting with this. I mean, you think about, kids and what gets them to have good behavior in their kindergarten class. A gold star on the refrigerator is a great motivator.
Uh-huh.
So it doesn't take much. It just takes acknowledgement, and it doesn't have to be a lot. And the interesting thing about that is that corporations that are doing this are not doing this because they're so benevolent. They're doing this because employees that move are more financially beneficial. They're out less, they're sick less, they're more productive. And so, again, they're reducing their disease burden and their payment burden on the backside because they're incentivizing wellness instead of disease. And so thinking about incentivizing people through every different number of ways. There was an interesting study that was published looking at Strava, and this was done with over 1 million subjects, looking at what effect your friend's exercise behavior had on you. And this was done from a group out of Israel, looking at if you had social media friends on Strava and they biked or ran, the next 3 days following that, people who were their friends were more likely to bike or run than people who were not their friends. And so they showed the statistical significance of that, women more likely to do that than men. But the further out from the reported behavior, the less likely were people to do that. So the day somebody said they did something, you were more likely to do it if you were their friend. So there's a whole social piece around this, too, that companies are doing, such as getting, different floors of a company or different groups of people in a company to kind of, compete against somebody else or to win this prize or to do whatever. And, again, it does not take much, but it takes thinking about incentive in a very different way. In the piece we just did in Time Magazine on this, I talked about, a future of healthcare where we start incentivizing the behaviors we want rather than paying for the diseases that are the result of inactivity. And there's very solid data on this, and we just have to think a little more creatively about how we approach this problem.
Well, how does exercise work across the whole body to help shield it from disease?
Well, that's a great question. And the answer is that some things we know and some things we have no idea about. We certainly know about oxidation of the brain. So when you were talking to me about at the beginning about, dementia and Alzheimer's and the progression of those problems, that's probably somewhat related to just basically increased oxygenation of the brain tissue. We know that, muscle and collagen strength, bone strength, tendon strength, ligament strength, all those things, cartilage strength, that's all related to kind of repetitive loading. And there's a piece there for sure. But there's pieces we don't know about, and particularly when it comes to the reduction of the general inflammatory risk in the body. So every chronic disease, from asthma to heart disease, has inflammation as a component of that, and certainly precancerous states, prediabetic states, et cetera. And when cells get inflamed, they tend to not work as well and have a host of problems. And so people are looking now, particularly in breast cancer models here at Memorial Sloan Kettering in New York, at the role of interleukin-6, which directs cellular activity with exercisers versus sedentary controls. And what we seem to be finding is that if you exercise, interleukin-6 is profoundly anti-inflammatory. So interleukin-6 made by muscle works in an anti-inflammatory capacity if you use that muscle regularly. If you sit around and do nothing, IL-6 is made by fat tissue, which is profoundly pro-inflammatory, so it has the exact opposite effect. And so the thought here is that basically chronic disease, which is often the result of chronic inflammation in the body, is basically prevented and in some cases treated well with daily exercise. And so that's why what many of us are recommending is exercise as the first-line drug for every single thing, and then we think about the other things we're going to do.
Dr. Metzl, I was fascinated with this Parkinson study because they really pushed people. I mean, you can't just walk your cat leisurely in the backyard and expect to get benefit in the brain. So tell us a little bit about this idea of high-intensity interval training.
So HIIT, or high-intensity interval training, which it probably needs a better name, but that's the acronym, is HIIT, H-I-I-T, is something I have been personally dealing with. I initially started that with myself. Then I started teaching my iron strength community classes with a HIIT focus. Then my most recent book, The Workout Prescription, is all about the science of HIIT and how people can do HIIT workouts at home on their own. And I am increasingly convinced that exercise is great, but high-intensity exercise, even for shorter periods of time, is not only more physiologically effective, I think it's more effective throughout the entire body. So that's why, for me, I am prescribing intensity for my patients, and I'm prescribing intensity for my 8-year-old patients and for my 80-year-old patients. I had a 75-year-old lady doing burpees in Central Park with me this morning in the rain.
What's a burpee?
A burpee is a kind of a full-body strength developed by Lord Burpee in 1938 here in New York City at Columbia, and it's kind of a squat thrust. It's a full-body strengthening move where you jump up in the air, kick your legs out, do a push-up, jump back up in the air, and it strengthens every single muscle at once. But the other benefit of the burpee is that it makes you huff and puff, and it's a cardiovascular exercise at the same time. So the idea here is that if you ramp up your heart rate and bring it down, ramp up your heart rate, bring it down, instead of taking the elevator, sprint up the stairs, or get that heart rate up, bring it down, get that heart rate up, bring it down. It's physiologically more effective, and from a cellular level, metabolically, it seems to metabolize glucose way more effectively. It resets your basal metabolic rate more and more effectively. So we think intensity is a big piece of this equation, and so that's why we're prescribing intensity for people through high-intensity interval training.
Can everybody benefit from exercise, Dr. Metzl?
Everybody can benefit from exercise and even from intense exercise. I want people all around the world to think about taking this prescription of exercise and moving every single day of their lives. It will make them healthier, happier, and live a longer life and a more cost-free life from a medical point of view than they would otherwise.
Thank you so much for talking with us on the People's Pharmacy today.
I love chatting with you guys. It's my pleasure.
You've been listening to Dr. Jordan Metzl, M-E-T-Z-L. He's a nationally recognized sports medicine physician, best-selling author, and fitness instructor who practices at the Hospital for Special Surgery in New York City. His most recent book is Dr. Jordan Metzl's Workout Prescription, 10, 20, and 30-minute high-intensity interval training workouts for every fitness level.
Lynn Siegel produced today's show. Al Wodarski and Russ Henry engineered the program. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
To buy a CD of today's show or any other People's Pharmacy broadcast, you can call 800-732-2334. Today's show is 1090. That number again is 800-732-2334, online at peoplespharmacy.com.
When you visit the site, check out information on prescription drugs, herbal medicines, and home remedies, but especially share your thoughts on today's show. Tell us about your exercise program and what it does for you.
At our website, you can also sign up for our free online newsletter or the free podcast of the show. You can listen at your own convenience or share it with a friend. We'd certainly appreciate you rating our podcast at iTunes. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening, and please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.